there's one thing more that the medicinal industry can do, and this is controversial. Am I allowed to say it on the podcast then? They're not so bad for biodiversity in a way, but they have a lot of money. So they could actually compensate, not even compensate, but just if they took some of that money, they could use it to care for biodiversity. Take a company like Novo Nordisk, they've got thousands of kroner, Frederik, it's crazy.
They have some kroner.
Right? If they use some of that to buy up natural areas and being like, you can't fuck with this is Novo protected land, they could in that way indirectly, increase or upgrade human health by upgrading the health of the planet. But again, this is controversial. This is also me, a biologist and a hippie, just thinking out loud.
Hello and welcome to the Sustainable Healthcare Podcast. Today we have a guest in the studio who's an expert on biodiversity. It's Alexander Holm from the Animal Hour, or Den Dyriske Time. And today we're going to talk about the healthcare sector and biodiversity. What is it that is a problem right now from the healthcare side of things? What are the contributions the healthcare sector has to the biodiversity crisis? But also we're trying to get a bit more actionable and see what is it you can do if you are in this industry in order to contribute or prevent or help in the biodiversity crisis. So welcome to the studio, Alexander. Thanks for coming.
Thank you. Thanks for having me.
What have you done today?
Well, I've been at work, and then I've been preparing a little bit of podcasts, and then I've been cycling here, and that's about it.
Nice. Doesn't sound like the worst of days.
It's pretty ordinary. Middelmåde, as we say in Danish. Yeah.
It's very middle-ish.
Yeah, very average.
The Animal Hour, or the Animalistic Hour, or Den Dyriske Time, your podcast, what is it about?
Well, it's about biology, first of all, biodiversity, climate, animal welfare. I figured that biology is usually pretty boring. When we hear about it, you're usually like, fuck biology. I remember I had it in high school, and I actually had it on A level, and I degraded it to B level just because I figured this is so boring, I can't have it. But I think there's many aspects of biology that are quite interesting and super relevant to us, and it just needs to be told in a different way. It needs to be dumbed down and made more edible, and that's what the podcast tries to do.
I remember biology class being a lot about pregnancies, and as a teenage boy, that quite didn't interest me. True. But the acronym HCG somehow stuck, so I still remember that has something. That's like that pregnancy thing.
Yeah.
No, but I mean, I think it also sort of sheds a light on where our society has failed, that we completely failed to spur that interest in young men on how our species is reproducing. Mm-hmm. I think that's a cultural feat that we just need to look at it, reflect, and say that that's very impressive.
Well done. Well done, buddy.
Well done, society.
Yeah.
But in all seriousness now, I know that you, in sort of discussing biodiversity in the healthcare sector, there's certain problems. But maybe before we go into talking about birth control and what the implications are from using birth control in sort of a biodiversity context, what is biodiversity and why is it important?
Well, two big important questions. Biodiversity is sort of the magnitude of species, you could say. So all the genetic diversity, the habitat diversity, and the species diversity, all of it just sort of combined. So you imagine you have all the species, and within each of the species you also have the genetic diversity. So if you combine that and then the habitats too, and when you take in the habitats you can add some variables such as the climatic variables too, and you take that and then you add all of it and then poof, you've got biodiversity. And why is it important? Well, first of all, there's some ecosystem services that life biodiversity provides. You know, the photosynthesis of plants and algae that give us the oxygen we need to survive.
Thank you, plants.
Thank you, plants. Thank you, algae. You have that. You have all the fresh water, for example, that you have cleaned by nature in a way. Some natural processes that are prevented by some plant erosion, for example. If you took away all the forests in the world, all the trees, you would have so many mudslides that you wouldn't believe. Places like Colombia and Nepal and what do I know, they'd just be all covered in mud really within a matter of fucking seconds. So biodiversity is just important. Also because of, it would be pretty shit to live on a dead planet.
Yeah. I think that's very neatly put.
Yep, thank you.
So what is it? Why it's important? And main conclusion is it would be pretty shit to live on a dead planet. So building off of that, looking at the healthcare sector, what are the challenges and the problems that you see, sort of this sector contributing to the biodiversity crisis with?
If we look at the drivers behind the biodiversity crisis, there's many of them, but one of the 5 main ones is pollution. And I think that...
What are the other ones? You have pollution, that's one.
You have habitat change, we destroy natural areas. You have invasive species. We introduce cats and rats and dogs and all that everywhere. And then you have climate change, and then you have overexploitation of species. And as I see it, you don't have, of course, if the healthcare sector is as climate friendly as they can be, they're not contributing too much to climate change, which is good. So let's take that one out. The healthcare sector, they don't really introduce invasive species, not as far as I know. So we can take that one out too. And if we take the other ones, pollution, and then it was habitat change. I mean, the healthcare sector, sure, they must use some products, for example, when they have to make yeast, for example, in order to make insulin and all that. They need to feed the yeast with something, which is probably some sugar of sorts. And they get that from somewhere, and they can make sure to get it from fields that are, taken care of, cultivated in the best way if we take into consideration all these biodiversity factors. So that's one, but as I see it, the main ones are, or the main one definitely is the pollution, and then a little bit the overexploitation of species. We have some species that they use in the healthcare industry, such as horseshoe crabs, for example. Those weird sort of living fossils. Looks a bit like something from Alien.
It looks like a biological tank almost.
Yes.
It's like that shell with like a little almost steel tail. Yeah.
Exactly, and they can use that if they tilt over, they can sort of tilt back. Yeah. And they've got blood that is extremely good at monitoring or catching if you have some, bacterial infection in something. So we used to catch tons of them and then tap all the blood and use that for seeing if we had some infections or if we had some bacteria where they shouldn't be. And then people were like, fuck, you're killing all the horseshoe crabs. So now instead we catch them and then we take them up and we tap half the blood and we release them. But research has shown that many of them die anyways. So I mean, that way the healthcare industry is, or part of it, is over-exploiting species. I can't come up with other examples that we exploit, but that's one example where it could be like, maybe not do that or find an alternative, because killing the horseshoe crabs is not a good thing.
I know that you're a big fan of Chinese medicine.
Oh yes, I love it.
And the World Health Organization has recently recognized Chinese medicine and certain practices within Chinese medicine sort of as real medicine in a way? Or
it's a bit complicated, but yeah.
Can you help our listeners sort of understand what is Chinese medicine?
Well, Chinese medicine is, it's Chinese. They make this, almanac, sort of like a protocol, a book that comes out every once in a while where they have all these recommendations for natural sources of medicine in a way. And it's fucking old as you wouldn't believe. And they take a lot of species, say pangolins, for example, and they say...
What's a pangolin?
Pangolin is a mammal, and there's 5 species of pangolin. They're the most hunted mammals on Earth. Wow. They look a little bit like armadillos, but they're not really related. And they've got scales. And then in Chinese medicine, you say these scales, they can help with this or that. And you have it in Chinese medicine, you say if you got a bad hangover, you can take some rhino horn, grind that shit up and snort it, and you're going to be good. They've got it all sorts of weird things, like the bladders of the swim bladder of the tatuoba, this fish over in the Mexican Gulf. They're like, mix this with that and it's going to cure cancer or whatever. And the thing about Chinese medicine is it's not really scientifically proven that it works. And you have so many species that are hunted to extinction because people want all these species or parts of them to use in this Chinese medicine. You have it with tigers too, where they make tiger wine with, I don't even know what, tiger bones you can use for whatever. And it's sort of very closely connected to the Chinese government, the Chinese medicine, because they make this book where they say what you can use for what. It's been so weird since the beginning. They had this thing in the beginning where they said, all otters are male, and you can use lead to cure whatever, and it's not exactly scientifically right.
It's not evidence-based.
No, it's not. And then the WHO saying that its medicine is a bit controversial. But it's also because like the former president of the WHO, she was Chinese and she was a bit advocate for Chinese medicine. And there's been tons of stuff. I'm not going to go into it because I don't know enough about it and I might be spreading, conspiracies, but there's definitely some links where you're like, come on guys, you can't really say, you can't acknowledge this as medicine because it's not.
So at large, we have a school of thought in Chinese medicine where sort of different compositions of compounds that are derived from rare animal species or from exotic species are being promoted without having a solid scientific evidence base as having certain effects.
Yeah.
And that leads to sort of extinction of species or species going sort of into the red zone of threat. Yep. So that would be a huge contributor, the way I see it, to sort of pressuring the biodiversity, of course, as also removing these species. They're also providing habitat and having synergies with other species.
Definitely.
But let's say that you are a pharmaceutical company and you're looking at it, you have an API production, so you have active pharmaceutical ingredient production. It could be through fermentation, as you said. You have some yeast that is producing yeast cells with certain sort of benefits or effects, and an input to feeding that yeast would be a sugar. Mm-hmm. So your first and most material concern should probably be looking at your strategic sourcing. What is the input sugar that we use for our production?
Good place to start. Yep.
Which questions should I ask my suppliers, or ask my suppliers to ask their suppliers? Because I would suppose the pharmaceutical company is not buying it straight from the farm. They'll have a range of different sort of middlemen going up through the supply chain. So how would you suggest they go about investigating sort of the biodiversity impact from sugar production?
You'd have to make one of those assessments where you look at where is it grown, first of all. Is it grown in old fields, for example? If they take sugar from, what do you call roer in beet? You take roesugar, Danish roesugar, it's like, yeah, fucking go for it. It's age-old. We're not cutting down any nature in Denmark because we don't have any. That's probably fine. But if you take cane sugar from somewhere where they cut down forest to make it, it's pretty shit. Don't buy that. Look into that, yeah, and otherwise just make an assessment. You have to decide, do you want it to be organic or not? Do you want all these things? And then, consider that. And I'd say...
So are you actually... So one question to ask would be, are we actively contributing to deforestation, which would go into that habitat loss you described, right?
Yeah.
And another one would be, are we actively contributing to pollution? Are we having sort of inorganic fertilizers? Are we having pesticides, fungicides, insecticides, or
all that,
whatever sort of sprayed around in the field, and therefore contributing to the pollution of the ecosystem?
Yep.
But when we're looking sort of at the pollution problem, and we already talked about pregnancy and biology class, but a great way to not get pregnant is to be born a man.
True.
Another great way is to take birth control pills. Why is that a problem?
Well, a lot of birth control pills are taken, and so some of the compounds in them, they're just coming out with the urine of the women taking them. And the water or the spillage is not being properly cleaned always, and then you have it all of a sudden out in streams and ponds and lakes and all that, and you can measure it in the fish and in the crustaceans and all that. You have some of the trout in Europe, for example, where you can see that they're actually being, by these hormones, they're being affected by them. Same with many other drugs.
I was just about to ask, so you can trace the hormones, great. So there's evidence that we can see it, but why is it a problem?
Well, that's because it's going to mess with the reproductive cycle of the animals. So we're sort of affecting nature in a way, right? And that's not necessarily good. It's the same with, you can measure it in bears in Sweden. They're actually getting so much antibiotics that some of them have developed, or some of them have antibiotic-resistant bacteria in them, just because they're eating whatever that's affected by whatever, again, coming out from our spillover from our medicine use. You see it with the paracetamol too. You can see that in the water somewhere. Cocaine, but that's not the medicinal industry.
That's a different problem.
Yeah, it is.
But I would say opioids that are
that too,
from painkillers would qualify as a problem.
But it's difficult, right? Because the medicinal industry, they make all the medicines, and of course they should. We need that. And then some of the compounds in them that are then spill into nature, it's difficult for them to control that, right? Because it's not their responsibility to clean all the sewage water. It's not their responsibility. So you could say, well, then make compounds that are more easily degradable, but it's not something that you just do.
No, it has a very long time to market, at least. If you develop something new that's clean, that's degrading in nature, and getting it to market is a very long, complicated process we call going through clinical trials. So you have something from a research stage where someone in a university has figured something out, and then it can qualify for going into clinical trials in order to be able to market it. And that process is typically several years, so all the way up to 10 years, and I think some of the fastest trials are like 5 or 6 or 7 years. We saw with the coronavirus, the vaccine being developed incredibly fast. And it was really, really quick. And a part of the reason behind it, there's a lot of conspiracy theory going on, but a very sort of solid part of the explanation that few people grasp is that if I'm developing a drug for someone with a very specific disease, it takes a very long time to recruit a patient group that's large enough that I can actually get the evidence I need to approve the certain stages. But with the coronavirus, you had everyone in the planet would be a good patient to review. Everybody wanted to contribute, so it was incredibly easy for them to get access to an incredibly large and diverse data set for patients, and that also having some regulatory speed, sort of speed up the processes. But at large, you could sort of position that story as being very scary, but there was also a reason that you were able to sort of circumvent some of the main contributors for clinical trials failing, which is patient recruitment. And they don't mention that in the news, that the main reason why new drugs, new treatments are not going on the market is actually because they have too high patient churn, and then they cannot find people that have the disease to a large enough degree that they can have the evidence needed to support that it's safe and that it's efficient. So that it's little known, but it also just means that when you're developing sort of what could become a blockbuster drug that would apply to most people, it's much easier to recruit the patient group because anyone could use it. So, you know, if I just need a person with a headache, easy. If I need someone with a rare disease or a chronic disease and an amputation or poor eyesight and poor hearing, you know, it's just narrowing down the group of patients I can recruit from.
It reminds me of the old saying that most people are most people.
Yeah.
I think that's Shakespeare.
Yeah, I mean,
maybe Descartes.
It should be, or Sartre.
It could be.
Well, one of those folks.
No, not Nietzsche.
No, definitely not Nietzsche.
No, he's too German.
The one thing that the healthcare sector is sort of the part that the healthcare sector is playing as well in the biodiversity crisis is actually compound pollution from various drugs being consumed by humans, and then the compounds going out and escaping into nature, and then going into the animals that are then facing reproduction issues or hormonal disturbances.
Yep. There's one thing more that the medicinal industry can do, and this is controversial. Am I allowed to say it on the podcast then?
I don't know.
So you have many sectors that sort of compensate for the, like the print they have on Earth. If they like have if they pollute a lot, CO2 or whatever, they sort of come in, they compensate, and they're like, we know we're fucking up a bit, so we're buying some forest here or whatever. Or some of them have like mining industry. They're like not too good for biodiversity and all that. Whereas the medicinal industry, they're not so bad for biodiversity in a way, but they have a lot of money. So they could actually compensate, or not even compensate, but just if they took some of that money, they could use it to care for biodiversity. Buy areas, all that. They could become ultra green in that way. They could sort of work not only to improve the health of us humans, but also to improve the health of the planet in a way if they use some of those thousands of kroner, you know. Take a company like Novo Nordisk, they've got thousands of kroner for, like, it's crazy.
They use some kroner.
Right? If they use some of that to buy up natural areas and being like, you can't fuck with this is Novo protected land, they could in that way indirectly, increase or upgrade human health by upgrading the health of the planet. But again, this is controversial. This is also me, a biologist and a hippie, just thinking out loud.
Yeah, and I think you're definitely touching upon something that's also quite material to the pharmaceutical sector. That if we're talking about developing new compounds, we need to find ways of doing it. And you had this the horseshoe crab that has something in its blood that makes it good for tracing bacteria or something else. At least it has a use in the healthcare sector somewhere. And the whole school of biomimicry is interesting here because, I mean, for you to have something to mimic, you have to have something to observe. True. And by having species going extinct, you're limiting sort of the field of solutions we could learn from. And that's going to influence sort of what kind of compounds are produced by which animals. There's something I found really, really interesting from, I think actually I heard it in your podcast. It was about the way the needle in a scorpion tail.
Yeah, it's got some metal in it.
Yeah, it has some metal in it. And it basically, the scorpion runs around being scorpion-like, and then it eats stuff, and it has some minerals that its biological organism somehow takes and sort of grows a metal inside its carbon-based life form. I mean, I'm an anthropologist here, so you know, I'm getting a little bit out of my.
I'm a biologist, and even I think it's a bit fucked up. But they do that. Got crustaceans doing it, and all. They incorporate a bit of metal just to become more metal, more hardcore. It's crazy.
And the reason why this is relevant is from a medtech device perspective. The scorpions have managed to produce an incredibly efficient way of puncturing skin, which you often need in needles for drug delivery. So, I mean, this is also just an example of this groundbreaking research that scientists have been able to observe this in nature, and I mean, I don't think it's far-fetched that soon enough we may be able to mimic this technology, this biotechnology that the scorpion has in its tail, to actually grow needles. And for companies that are producing medtech devices, needles it's a huge problem to produce those needles and make sure that they puncture the skin every time, that they're strong, they're resistant, because they're typically, if you have to puncture the skin, you're doing something that's quite critical. And if it's about the delivery of a drug, you're probably having something that is life critical that needs to be delivered. So that needle has to work every single time, making it a quite costly part of the industry. And we could imagine that it could be cheaper to grow it organically in a lab, rather than having a mining industry having to take out, it's kind of like, as we say in Danish, it's crossing the bridge to get water.
Yeah.
When we have the technology to potentially actually grow them in a petri dish.
I mean, what you could do, and it might be a bit tricky, that was to, if you took the cells that you have in the scorpions that grow the stinger, and you could orchestrate in a way you could make those grow needles. I don't know if it's doable, but if you could potentially do it. It's a bit like one time you incorporated the cells that you have in spiders that produce the web. You incorporated that into the what do you call that? The tits of a goat.
Yeah.
And you had that goat actually produce sort of spider's web through the tits. And you wanted to see if you could grow that in a way and if it would fold so you could use the spider web because, it's so strong. But it was all fucked up and you just had some weird liquid come out. But you could maybe potentially do it. I mean, I'm not knowledgeable enough about what's doable or not, but maybe so, yeah, you could have sort of organic needles grown in that way. You also had another good point with many of the compounds, many of the active molecules that are used in medicine that we first stumble upon in nature, paracetamol, for example. And as we cut down more and more of the most biodiverse regions on Earth, thinking rainforests here, we lose potentially a lot of medicine or a lot of compounds that could be used in medicine. So conserving those areas might actually be good for medicinal industries. Just because, if you take something like the Amazon, you have, 180,000 species of plants in there already discovered, and probably many more that we haven't discovered yet. And who knows how many of them have some molecules in them that we can use for something.
Yeah, that we haven't even found yet. That's really interesting perspective. Yeah. Alexander, thank you so much for coming on the show again. I learned a lot from the conversation. I feel like I always do. So feel more than free to come again.
Just invite me, I'll be here. Thank you.
For our listeners that speak Danish, please take a listen to Den Dyriske Time. It's a truly great show. I really enjoy it. And thanks a lot for doing that.
Thank you.
Thank you so much for listening to this episode of the Sustainable Healthcare Podcast. I really hope that you learned something. I hope that you found something insightful that you can use in your own life. Please provide us feedback with what you think of the show. If you wouldn't mind rating, liking, subscribing, sharing, we'd really appreciate it. We do this in order to help decarbonize the healthcare sector. So that's why we're here. So if there's any way, shape or form where we can improve and you know about it, please let us know. We will hugely appreciate it. Thanks a lot for listening.